Hi, my name's Rylee, and this is my patient Allison. We are here today to talk about her eating habits and see how the types of foods that she's eating is affecting her oral health. The purpose for this is to see what we need to change in her diet to improve her oral health and lower her risk for getting cavities. So, in her dental history, your past and current dental information looks very healthy. You've had sealants placed to prevent decay from happening, and throughout your 21 years of life, you only had two fillings, which is great. And I see you've had a continuous fluoride exposure throughout your life through water fluoridation, toothpaste, and going to the dental office and having that applied. As of your last dental exam, you've had no caries, which is great. Your medical history doesn't appear to be any of concern since the only medications you are taking is birth control, which is causing no adverse effects in your mouth. You have no documented food allergies or special diets. And for food dislikes, all you have listed is raisins and mushrooms. As for your activity level, I see you're at a moderate level for daily activity, meaning you are physically active for 30 to 60 minutes per day, which is great. So keep that routine up. For your eating routine, it's really balanced. So you eat a breakfast, lunch, supper, and have a protein shake every day. Your food intake is very healthy and nutritious, which is awesome. So I have no further recommendations for changing any of that. As for carcinogenic exposures, the only items I noted that were high in sugar were the granola you had at breakfast for one day, some chocolate milk, and chocolate-covered almonds as a snack. As long as you're brushing and flossing your teeth before bedtime after having those almonds and chocolate milk during the evening, your oral health should maintain at a healthy state. Although, if you do not brush your teeth before bed, those sugars from the chocolate will just sit in your mouth and make your mouth more acidic. The constant change in the pH is what causes us to create cavities over time. So as you can see in this little chart here, when you're eating these sugary foods, the bacteria causes us to get acids in our mouth, and then the acids is what attacks our teeth structure, causing the cavities. So as for cavities prevention, you have a low risk, so I'm not too concerned about anything with that. I'll just say again, brush and floss your teeth before you go to bed after you have sugary foods at night. So modifying your diet plan. You have a very, very balanced diet, so I'm not concerned about modifying that much at all, since almost all of your daily intakes of food are good sources of healthy nutrients for your body. There's not too much to worry about. As for the one day, for your nutritional guide, there's just a few areas where your pH went below that 5.5, but they were just spaced out, so that's good between those 20 minutes. So nothing of concern. So in closing, all in all, you have great nutritional eating habits along with excellent oral hygiene and caries prevention measures.